Hi, my name is Shah. I'm the Director of Breast Radiation Oncology and the Director of Clinical Research at the Cleveland Clinic. Inflammatory breast cancers are quite rare, but when diagnosed, require very specific treatment regimens. A common question in the face of a diagnosis of inflammatory breast cancer is, what's the role of radiation therapy? When we look at inflammatory breast cancers, it's important to understand how those cancers end up progressing. These cancers have a high risk of recurrence on the chest and the lymph nodes, as well as a high risk of cancer spreading elsewhere or distant metastatic disease. As such, treatments must be aligned to help reduce those risks of recurrence. The mainstay treatment with respect to inflammatory breast cancer starts with chemotherapy prior to surgery. This is known as neoadjuvant chemotherapy. This is recommended for the majority of patients with inflammatory breast cancer. Following a diagnosis of inflammatory breast cancer, it's also important to perform staging studies to make sure that the cancer hasn't spread prior to initiating treatment. Following chemotherapy, we typically recommend surgery if the patient's felt to be operable. Surgery in most cases of inflammatory breast cancer should include mastectomy as the standard of care surgical approach. At this time, it is not recommended for patients to undergo reconstruction at the time of mastectomy, the diagnosis of inflammatory breast cancer, though there are limited series demonstrating that this is safe and effective. Following surgery for inflammatory breast cancer, radiation therapy is the standard of care. It's important for patients to recognize that even with a perfect response to chemotherapy and surgery, for example, finding no residual cancer at the time of surgery, that radiation therapy absolutely remains the standard of care in the setting of inflammatory breast cancer. With respect to radiation therapy, radiation should include the chest wall, the lymph nodes under the armpit, or also known as the axilla, the lymph nodes above the collarbone, known as the supraclavicular lymph nodes, and the lymph nodes in the first part of the spaces between the ribs, called the internal mammary nodes. Radiation therapy should be given daily, Monday through Friday, for 5 weeks to this area. Additionally, due to the high risk of recurrence, we often give an additional dose of radiation to the area surrounding the scar in women with inflammatory breast cancer, called a chest wall scar boost. Finally, with respect to radiation therapy technique, in patients with inflammatory breast cancer, we use a technique called bolus, which increases dose to the skin. While this is commonly used in women who have non-inflammatory breast cancers, in the setting of inflammatory breast cancers, we often use this throughout the whole course of treatment. This can lead to a significant increase in redness of the skin, but is done due to the increased risk of skin recurrences in women with inflammatory breast cancers. Finally, some centers may offer radiation twice daily in the setting of inflammatory breast cancer, and this remains an accepted regimen as well.